Hello everyone, in this video we'll be going over the management for latent TB infection. Before we go over that information, let's first do a question to test our knowledge regarding this topic. Here we have a healthy 7-year-old girl, recently emigrated from India, presents for a well-child visit. She is asymptomatic, up to date on immunizations, and in the 60th percentile for growth. Exam and chest x-ray are normal. Labs show hemoglobin, white blood cells, platelets all being normal. Hepatitis B surface antigen is negative. Hepatitis B surface antibody is positive. Interferon gamma release assay is positive. What is the most appropriate next step in management? So, a child coming from a TB endemic area like India must be tested for a TB infection. So, the fact that this patient is asymptomatic and her chest x ray being normal tells us that there's no active disease process going on. But the fact that she has a positive release assay tells us that she has a latent TB infection. Now remember that interferon gamma release assay is not likely to be affected by a prior BCG vaccine, so she's not likely to have a false positive test. Now let's go over the information regarding the management of latent TB infection. So when to treat. If a patient has a positive interferon gamma release assay or tuberculin skin test, then we must treat the patient for latent TB. Now, but before doing that, we must rule out an active TB infection. The preferred regimens are going to be weekly isoniazid plus rifapentine for 3 months, or we can do a daily isoniazid plus rifampin for 3 months. Alternative regimens include rifampin for 4 months if they are intolerant to isoniazid, or we have a isoniazid resistant TB. Special populations include patients with HIV or rifamycin contraindications. Then we can do isoniazid for 6 to 9 months. Adjuvant therapy, we can give the patients vitamin B6 because it is going to prevent peripheral neuropathy from isoniazid. So that is all I have for today. If we go back to the question, the answer is going to be answer choice C. Remember that the preferred regimen is going to be isoniazid and rifapentine, or we can give them isoniazid plus rifampin.